What is PCOS? Polycystic ovary syndrome. PCOS is a common condition that affects how a woman's ovaries work. It's characterized by hormonal imbalances that can impact various aspects of reproductive and metabolic health. Prevalence affects approximately 1 in every 10 women in the UK, making it one of the most common endocrine disorders in women of reproductive age. Hidden nature. More than half of women with PCOS do not experience any noticeable symptoms, meaning many cases go undiagnosed. The 3 main features of PCOS: a diagnosis of PCOS requires the presence of at least 2 of these 3 key characteristics. Irregular periods. Ovaries do not regularly release eggs. Ovulation, leading to unpredictable or absent menstrual cycles. Excess androgen. High levels of male hormones causing physical signs such as excess facial or body hair growth. Polycystic ovaries, enlarged ovaries containing many fluid-filled sacs, follicles surrounding the eggs. Understanding polycystic ovaries. Despite the name, polycystic ovaries don't actually contain cysts. Instead, they contain a large number of harmless follicles that are up to 8 millimeters, approximately 0.3 inches in size. These follicles are underdeveloped sacs where eggs develop. In PCOS, these sacs are often unable to release an egg, preventing ovulation from taking place. This disruption in the normal ovulation process is what leads to many of the reproductive challenges associated with PCOS. When do symptoms typically appear? PCOS symptoms usually become apparent during a woman's late teens or early 20s, coinciding with the establishment of regular menstrual cycles and hormonal maturity. Late teens, initial symptoms might begin to manifest as hormonal changes occur during adolescence. To early 20s, symptoms typically become more pronounced and recognizable during this period. 3 ongoing symptoms may continue throughout reproductive years without proper management. Common PCOS symptoms. The symptoms of PCOS can vary significantly between individuals, but several key signs are commonly observed. Irregular or absent periods. Menstrual cycles may be unpredictable, infrequent, or completely absent due to disrupted ovulation patterns. Fertility difficulties. Challenges getting pregnant as a result of either ovulation or complete absence of ovulation. Excessive hair growth. Hirsutism typically affects the face, chest, back, or buttocks due to elevated androgen levels. Additional physical weight gain. Many women with PCOS experience difficulty maintaining a healthy weight, particularly around the midsection due to insulin resistance and hormonal imbalances. Hair thinning and loss. Male pattern baldness or thinning hair on the scalp can occur, contrasting with excessive hair growth in other areas of the body. Skin changes. Oily skin and acne are common due to increased androgen production, affecting facial appearance and self-confidence. Long-term health risks. PCOS is associated with an increased risk of developing serious health complications later in life. Understanding these risks is crucial for long-term health management. Type 2 diabetes. Insulin resistance associated with PCOS significantly increases the risk of developing type 2 diabetes, requiring careful monitoring of blood sugar levels. High cholesterol. Elevated cholesterol levels can lead to cardiovascular complications, making heart health monitoring essential for women with PCOS. What causes PCOS? The exact cause of PCOS remains unknown, but research has identified several contributing factors that work together to create this complex condition. Genetic component. PCOS often runs in families, suggesting a strong genetic predisposition. If your mother or sister has PCOS, you're more likely to develop the condition. Hormonal imbalances. The condition is fundamentally related to abnormal hormone levels of the body, particularly involving insulin and androgens. The role of insulin in PCOS. Insulin plays a central role in PCOS development and symptom manifestation. Normal function. Insulin is a hormone that controls sugar levels in the body by helping cells absorb glucose from the bloodstream. Insulin resistance. Many women with PCOS are resistant to insulin's action, meaning their cells don't respond effectively to the hormone. Compensatory response. The body produces high levels of insulin to overcome this resistance, leading to elevated insulin levels. Hormone disruption. Excess insulin contributes to increased production of androgens like testosterone, worsening PCOS symptoms. Weight and insulin connection. PCOS symptoms. Insulin resistance, increased insulin, weight gain. Being overweight or obese significantly increases the amount of insulin your body produces, creating a challenging cycle. Excess weight worsens insulin resistance, which in turn makes weight loss more difficult. And exercise, PCOS symptoms. This interconnected relationship highlights the importance of weight management in the PCOS treatment. PCOS treatment overview. While there's no cure for PCOS, the symptoms can be effectively managed through various treatment approaches. The key is early intervention and comprehensive management. Medical consultation. Speak to a GP if you think you may have PCOS. Early diagnosis and treatment planning are essential for optimal outcomes. 2, lifestyle modifications, weight management, and dietary changes form the foundation of PCOS treatment for many women. 3, medical interventions. Various medications are available to address specific symptoms and complications. 4, surgical options. In some cases, surgical procedures may be recommended for fertility treatment. Lifestyle management strategies for women with PCOS who are overweight. Lifestyle modifications can significantly improve symptoms and ovary health outcomes. Weight loss benefits. Losing even a modest amount of weight, 5 to 10% of body weight, can lead to significant improvements in PCOS symptoms, including more regular periods and improved fertility. Dietary approach. Eating a healthy, balanced diet helps manage insulin levels and support sustainable weight loss. Focus on whole foods, lean proteins, and complex carbohydrates. Medical treatment options. Various medications are available to target specific PCOS symptoms and improve quality of life. Hormonal treatments, birth control pills, and other hormonal medications can help regulate periods and reduce androgen levels, improving skin and hair symptoms. Fertility medications. Specialized drugs can stimulate ovulation and improve chances of conception for women trying to become pregnant. And the androgen therapy medications specifically designed to reduce excessive hair growth and other effects of elevated hormones. Surgical treatment, laparoscopic ovarian drilling. When fertility medicines prove ineffective, a surgical option called laparoscopic ovarian drilling, LOD, may be recommended. The procedure, LOD, is a simple surgical procedure that involves using heat or laser technology to destroy the tissue in the ovaries that produces excess androgens such as testosterone. This minimally invasive approach can help restore normal ovulation patterns and improve fertility outcomes for women who haven't responded to medication. Fertility outcomes and pregnancy success. Good news, with appropriate treatment, most women with PCOS are able to achieve pregnancy and have successful outcomes. The key factors for success include early diagnosis and treatment initiation, consistent lifestyle management, including weight control, appropriate medical intervention where needed, regular monitoring and adjustment of treatment plans, patient education and support throughout the journey. Managing PCOS, a holistic approach, medical care, regular checkups and appropriate medications, nutrition, balanced diet and weight management, exercise, regular physical activity and fitness are important for managing PCOS and improving overall health. Mental health, emotional support, and stress management are crucial as PCOS can impact mental well-being. Education, understanding the condition and treatment options empowers women to take control of their health. Living well with PCOS. PCOS is a manageable condition that doesn't have to define your life. You need proper understanding, treatment, and support women with PCOS to lead healthy, fulfilling lives and achieve their reproductive goals. Stay informed. Keep up to date with the latest research and treatment options. Knowledge empowers you to make informed decisions about your health. On support networks, connect with other women who have PCOS, healthcare providers, and support groups that share experiences and strategies and maintain regular care. Consistent medical follow-up ensures your treatment plan remains effective and can be adjusted as needed. When to seek medical advice, it's important to consult with a healthcare provider if you experience any combination of PCOS symptoms. Early intervention can prevent complications and improve long-term outcomes. Important, this information was last reviewed on 11th October 2022, with the next review due on 11th October 2025. Always consult with qualified healthcare professionals for personalized medical advice and treatment recommendations. Red flag symptoms: persistent, irregular, or absent periods, difficulty conceiving after 6 to 12 months of trying, sudden onset of excessive hair growth, rapid weight gain, or difficulty losing weight, and severe acne that doesn't respond to treatment. Key takeaways: PCOS management. Understanding and managing PCOS requires a comprehensive approach that addressing both immediate symptoms and long-term health considerations. Early recognition, PCOS affects 1 in 10 women in the UK. Recognizing symptoms early leads to better outcomes and prevents complications. Treatable condition, while there's no cure, PCOS symptoms are highly manageable with appropriate lifestyle changes and medical treatment. Fertility hope, most women with PCOS can achieve pregnancy with proper treatment, whether through lifestyle changes, medication, or surgical intervention. Lifelong management, success requires ongoing commitment to every lifestyle choices, regular medical care, and stay informed about treatment analysis.